All right, we're just going to get started in 3 minutes. I'm going to let people keep entering here. Welcome. Welcome to a Monday night. Happy to bring this topic to you here tonight. It's one that's been a lot of fun for me. So hopefully we have some really good information here. Hopefully I clear up some mystery about liposuction and liposculpting. And I tried to make this really a little bit like a consult in a video so that it can answer some questions that you might have about the procedure and about related procedures. So tune in. We've got like 3 minutes to go. I might have some dogs joining me shortly. They're going to flow in the room here, I think. But welcome, everybody. It's been great weather here in New Hampshire, except for the high winds that took down a big tree limb just outside our front window. So that was a little scary the other night, but no damage done, so all good. Don't forget there's a chat box if you have specific questions. I'm happy to address those. I will try to, let me see if I can highlight that chat box here. Okay, there we go. So hopefully I'll see questions if they come up along the way. And again, remember that this presentation is certainly going to be available on our website, but it will also be available on Facebook shortly. And a finalized, cleaned up version will hit our YouTube channel later this week, so that this is something you can watch again in the future. You can share with anybody else who you think might be interested in watching the presentation. It's something that will live on our YouTube channel. That's the goal here, really, is that this information is sort of evergreen and lives on our YouTube channel, on our website, so that someone can access it down the road to really inform themselves about a procedure that they might be considering. And liposuction or liposculpting is going to be the topic of tonight's live stream. So thank you for joining me. Now, 1 more minute to go. Going to get rid of that. I'm not sure what that is. And I'm just going to check with my tech guy. Let's see if we're good. All right. Check on TeamViewer. This stuff is so technical. Makes me crazy sometimes. Okay. I think he's okay. Yep, he's in. All right. Cool. I think we are ready to go. Getting a little bit of a later start today. So again, today's topic is actually liposculpting, and specifically how we perform liposculpting at Renew MediSpa. So this is certainly a customized procedure. It's not done exactly the same from one place to another. So I want to make that clear. This isn't a one size fits all or one way to do it sort of thing. This is really art in medicine. So I'm going to explain to you our process. That doesn't mean that it's exactly the same done in another location. So my name is Dr. Lisa Vuich. I'm the medical director and owner of Renew MediSpa and the Renew MediSpa Training Institute located in Derry, New Hampshire. I'm also a clinical educator and master aesthetic trainer for specialty med training, and I'm board certified by the American Academy of Aesthetic Medicine. In addition to some research activities, I am a member of multiple associations, including the American Academy of Cosmetic Surgery and the American Association of Aesthetic Medicine and Surgery, which is one of the associations I trained with when I was preparing to do liposculpting. And I've been a guest lecturer at a variety of different events. So non-surgical aesthetics of the face and body is something we specialize in at Renew MediSpa. Of course, we also specialize in sexual wellness procedures for men and women. We do, on the Training Institute side, small and medium-sized group trainings for physicians and nurses looking to train in the procedures we perform. And I offer preceptorships, which are basically private and semi-private training experiences for doctors and nurse practitioners. We also do webinars and online training modules. So we are very active in the aesthetic medicine space and very active in education. So I'm very proud to bring you this information also as a way to inform you as the potential patient, client, consumer to make sure you're making the best possible decision in your aesthetic arena. So the outline of this presentation is fairly simple. I want to go over some definitions because the terms get a little muddy in this area. I'm going to show you the equipment we use. We're going to talk about why someone might consider doing liposuction or liposculpting. What's the safety of the procedure? What are the risks of the procedure? How do we get you numb as an outpatient for this when we're not doing it in an operating room, essentially? Of course, we want to cover who is and who is not a candidate for liposuction in general, and how you might prepare for this procedure in order to get ready and know what the requirements are before you go into it. We'll talk about what happens on the day of the actual procedure. And again, this is specific to Renew MediSpa. And I'll also talk a bit about Venus Bliss, which is a device we're using during the healing phase post-lipo so that we can get the best possible outcomes. And finally, of course, we'll show you before and after results that we've achieved at Renew. So very simply, liposuction, as the name certainly implies, is sucking fat out of the body. This is simply the removal of subcutaneous fat from a specific region of the body. And we're using cannulas, which are hollow metal instruments attached to a suction device to remove the fat. Seems simple, but it really isn't all that simple. When we start talking about liposculpting, I like to reserve that term for a set of procedures. Okay, so to me, as a provider, liposculpting means I'm doing more than just sucking fat out. I'm doing something in addition to contour the area, to improve the outcome, to make it smoother, something else, not just the sucking out of the fat. Because if it was just fat sucking, we might as well say liposuction, right? Liposculpting to me means we're doing something in addition. So what might that extra procedure be that we're marrying to the suctioning of fat? Well, we can do things to disrupt the fat before we actually remove it. We can melt it with laser, which is what we're going to talk about. We can mechanically separate it or equalize it with cannulas, which is also something that I perform. The liposuction itself is either manual, meaning someone's just using suction pressure to remove fat, or what we do at Renew is actually we use vibration-assisted liposuction, which means that the cannula, which is attached to suction, is also vibrating at a certain frequency. And that just makes the removal of the fat actually more efficient. So there are ways where you can get fancier about how you suck the fat out. Fat transfer is not something I currently perform at Renew MediSpa, but some physicians will take the fat out of one area and inject it into another. So that could be another type of sculpting with fat. So we'll put that under the tag of liposculpting. Lipolysis, I tend to reserve that term for shrinking fat cell size rather than removing fat cells or destroying fat cells. So we'll talk a little bit about that. And finally, skin tightening. To me, that's the most important thing to marry to liposuction, because listen, if you're over the age of 40 and we're sucking fat out, you probably need the skin that's left behind tightened for the most ideal outcome, because the last thing we want to do is look better in clothes, but worse naked, right? I mean, we don't want that. We don't want hanging flabby skin if we can help it. All right. I don't want to trade fat for flabby skin if I can help it. So that to me is a very crucial part of the procedure at Renew. And we love the skin tightening aspect. So Smart Lipo at Renew MediSpa consists of this. It is laser-assisted disruption of the fat, and I will show you this exactly what it is. It is vibration-assisted liposuction. That's the removal of the fat, and also ideally followed by some form of lymphatic drainage. And if you need more skin tightening than what was provided by the procedure, you can certainly also do that as well. Our equipment for the laser piece is the Smart Lipo Triplex. This is a device which has been around for a very long time. Certainly, there have been different iterations of it, different advances, but the Triplex is the latest version of this particular laser. It has 3 laser wavelengths. They achieve fat cell disruption. Basically, they're breaking up the fat cells and actually melting the fat before we even remove it with suction. This means that the fat removal for us is more efficient. There is less bruising and less bleeding with this procedure because the laser is coagulating the blood vessels, which would otherwise ooze during a traditional liposuction procedure. So when you're using Smart Lipo Triplex, you're losing fewer red cells and you're bruising less. More importantly, there is significant skin tightening, which is achieved with this. As you can see in that graphic on the right, liposuction alone, just because of the trauma of the procedure, will result in some skin tightening during the healing process, but that can be remarkably enhanced by combining the laser heat to offer a lot more skin tightening in the same region that you're sucking the fat. Now, important to understand here, the laser device, the Smart Lipo laser, this $250,000 device, doesn't actually suck the fat out. We need a whole separate device to do that. So when you're getting Smart Lipo done, you're actually getting multiple procedures done at the same time. You're getting the laser procedure to disrupt the fat, break up the cells, melt the fat, tighten the skin, and then over and above that, we need a completely additional suction procedure to remove the fat. The laser itself does not remove the fat. This is a liposuction station or liposuction cart. It has, as you can see, IV bag holders. Okay, you can see them at the top. That's the lidocaine solution at the top, which we prepare individually for your procedure. There's an infusion pump, something that actually pumps the lidocaine into the fat to make you numb for the procedure. There are canisters in the middle there. You can see those red top canisters. That's where the fat collects that we're suctioning out. And finally, at the bottom, that big bulky looking thing, that's the aspiration or suction pump. So there's your Lipo Valet cart, as we call it. That is your liposuction workhorse right there, not the laser. What I use in addition to the laser and in addition to what I just showed you, the Lipo Valet cart, is something called the Vibrostat Pro. This is simply an additional piece of equipment which enables me to once again more efficiently remove the fat. This attaches to the cannulas that the fat is being removed by, and it vibrates the cannula at a certain frequency so that as I'm moving back and forth under the skin with the cannula is also vibrating. And that essentially just basically equates into more efficient fat removal and a smoother result. And that is the key here to me. Smooth result, more efficient, and safer are key terms here. So the combination of the Smart Lipo Triplex laser to dissolve and disrupt the fat, along with the Vibrostat Pro to make more efficient the extraction of the fat with the suction device, is what we use to deliver a smoother result and also to reduce downtime. Here you see my actually regular injection room set up for liposculpting at Renew. So on certain Thursdays and Fridays every month, this room transforms into what you see here. We have our sterile field set up. We have the table set up with a sterile field as well. And that close-up image on the right that you see there, that's the Vibrostat, which is going to attach to my liposuction cannulas. And that, of course, too, is on a sterile tray. So this is now my room where I normally inject Botox and filler, now set up to perform a more advanced procedure. So how do we do this? How do we even conceivably do this outside of an operating room? The key to that is something called tumescent liposuction. So very simply put, tumescent means we take the numbing medication, which is lidocaine with some epinephrine and bicarbonate solution, and we instill that solution into the fatty layer under the skin. And it's really been advances in this technique of tumescent anesthesia that made it possible, or made it really feasible and acceptable to me as a non-surgeon, to begin to perform this procedure at an otherwise non-surgical facility. So what this means is that this solution of lidocaine and other additives is instilled into the fat under the skin to make the region locally numb. We do not need to start an IV. We do not need to breathe for you. There's no general anesthesia required for this. We do use oral medication to help you relax. That's something we actually call in for you, that you pick up at a pharmacy ahead of time. And we have additional oral medication available should you need additional doses. So we have that on site. That's simply to help you feel more relaxed during what can otherwise be a somewhat anxiety-inducing procedure. We also have something called Pronox, which is an inhaled nitrous oxide, or what some people refer to as laughing gas. So we have some people who will use that during the numbing process to further help them relax during that portion of the procedure. Once again, the laser is used to disrupt the fat cells and also to heat the skin to facilitate skin tightening. So finally, laser-assisted liposuction is basically this concept of adding the laser energy to achieve better, smaller area detail work. And we're able to do that because we can numb that fatty layer with this lidocaine solution without putting someone under general anesthesia. Here's an example of a recent result. You can see the day of procedure on the left. We'll look at this more closely later, where I've marked out various regions that we're going to treat with the laser energy and also remove fat from. And then you can see a follow-up photo there with her nicely slimmed down. And on the right, I show you the immediate post-procedure photo. So you can see this looks pretty tame. There are just some small entry points which are strategically placed in areas that would be cosmetically not disruptive. And, there's nothing crazy looking here. It's actually quite benign. So how popular is liposuction? Well, even during a pandemic year, there were more than 200,000 procedures performed in the US, making it the fourth most popular procedure in plastic surgery in 2020. There are some years where there've been 400,000 procedures and lipo's been like number 2. All right. So it's always at or near the top of the list. Usually, Botox might be at the top of the list, but lipo is always up there pretty high. Now, understand that this number is likely a gross underestimate, because numbers like these come from the American Society of Plastic Surgeons as reported by its group members, which are surgeons. Now, most who seek liposuction have had difficulty achieving the look they want in a particular body area, like the abdomen or the hips or the back of the arms, despite diet and exercise. And we'll talk about that a little more. Many of them have tried some form of non-invasive procedure, such as Coolsculpting or other procedures, and haven't gotten the appearance that they want. So that is a scenario where you might consider a minimally invasive procedure like outpatient liposuction. The cannulas we use for liposuction have a variety of designs, many more than what I'm showing you here. Understandably, they're connected to suction. Importantly, they are blunt, okay? They are smooth or tapered tip, but they are not needle sharp by any means. And the cannulas that are used for the outpatient tumescent liposuction are smaller and thinner than the cannulas that are used generally in the operating room for traditional lipo. And I'll talk a little bit about the difference between traditional lipo and this outpatient tumescent liposuction. But essentially, if you take a cannula with some form of holes and you connect it to suction and you move it back and forth in the fat under the skin, you're going to achieve the removal of some portion of fat cells. They'll go into the lumen of the cannula and get sucked into one of those canisters. And that's essentially how we remove the fat. Now, non-invasive, completely non-invasive forms of liposculpting do exist, of course. We use several heat-based non-invasive fat cell destruction methods. We currently utilize TrueSculpt as well as Venus Bliss. TrueSculpt is radio frequency, Venus Bliss is laser. Also has radio frequency aspect for skin tightening. We also have Sculpture, which we don't use as much these days, but that's a laser-based procedure. It turns out that fat cells do not like extremes of hot or cold. So when you expose fat cells to extremes of heat, you can destroy some of the fat cells. So these devices do this without breaking the skin barrier. And that may sound great, but there are some disadvantages to that. The disadvantages to non-invasive fat cell destruction are primarily that if you have deeper layers of fat or significant amount of fat to deal with, you might not get all the removal you had hoped for because you're only affecting fat that's within reach of the heat. It requires multiple sessions spaced out over potentially an extended period of time, so it can be slow going. And it's hard to predict for an individual person exactly how many sessions will be needed. So these are great tools. We do love our non-invasive fat cell destruction devices, but we have to recognize that even these devices have limits. And for certain patients, it may make sense to go straight to a minimally invasive procedure, particularly if they have larger areas of fat to deal with. But again, the advantages are completely non-invasive, zero downtime, nothing to plan for, no restrictions, and overall very little risk of complications. Now, you might have heard of a cold-based procedure for fat cell disruption. I'm sure you've probably heard the term Coolsculpting, and you may have recently seen some information on the internet about Linda Evangelista, who is now suing the makers of Coolsculpting, saying basically that she's been brutally disfigured. Unfortunately, Linda, the supermodel Linda Evangelista, basically had a complication called paradoxical adipose hyperplasia. This is a situation where the area that's treated with the Coolsculpting device actually gets worse rather than better. And that's a really bad scenario, unfortunately. She developed apparently hard, bulging, painful masses. That's what happens with PAH under her skin in the areas where she had the procedure done, and she had it done in multiple areas. So she has now lodged a $50 million lawsuit against the company. PAH is not anything new in the aesthetic arena. We've known about this for a long time. Unfortunately, we do believe now that perhaps this complication is more common than was initially reported. So again, this is PAH is the unexpected overgrowth, which hyperplasia means overgrowth, of fatty adipose tissue in the region that has been treated by Coolsculpting. This does not happen with heat-based procedures, only with the cold-based procedures. Now, based on the data from the manufacturer of the device, PAH has been estimated to occur in about 1 out of 4,000 treatment cycles. A treatment cycle means you go in, you get a session done, you go home. That's a treatment cycle, okay? So 1 in 4,000, or an incidence of 0.025%, is what the manufacturer had previously estimated as the incidence of PAH. Unfortunately, if this happens to you, the only treatment for this condition is actually surgery. You probably need at least liposuction, and you may need an additional surgical procedure to remove this fatty mass that develops post-procedure. So here's actually a report in Laser and Surgical Medicine in 2015 questioning paradoxical adipose hyperplasia secondary to cryolipolysis or a Coolsculpting type procedure. Is it an underreported entity? Here's what we don't know. What we don't know is if there are certain patient types, be it a certain demographic, a certain, is it Hispanics more? Is it Europeans more? That sort of thing, certain heritage. We don't know really if there are certain types of patients who are more risk than others for this complication. And we also don't know for sure if it was more of an issue with older models of the Coolsculpting device versus their latest or newest iteration or newest model of the device. The biggest problem I have with cold-based fat destruction technology is that cold does not tighten. Okay, cold does not tighten skin. And that is the main reason that I refuse to bring in a cold-based fat destruction procedure way back in the day. Okay, it doesn't matter. Aside from PAH, cold does not tighten. So I would prefer to use a heat-based method if we're going completely non-invasive so that we get both fat destruction and tightening at the same time. What is not at all uncommon with a cold-based procedure are irregularities, okay? The cold-based procedures are very focal, very concentrated. The cold doesn't spread out the way heat does. So unfortunately, what does happen much more often than the PAH are surface irregularities. Now, you may see them called step-offs or dents, or in the industry, we call them shark bites. Why? Because all of a sudden you see this, this divot in the abdomen or the thigh or wherever the person's been treated. It's like this, a shark bite, literally. That's what we call them. And unfortunately, a lot of people that happens to are then going to a heat-based procedure to try to smooth out that problem. So again, just a side effect of the fact that cold doesn't tighten. So obviously I'm not a big fan of Coolsculpting, but I just want you to be aware, I spent some time on this because it's important to understand that even the non-invasive fat sculpting procedures do have potential complications. And these are things that you might want to consider and ask about. This in particular, a frostbite complication, was not reported with the Coolsculpting device specifically. This was another device called Yeti, which is in Italy. But this patient, unfortunately, had pain during a procedure, and the technician thought, oh, well, that's expected. But that person went on to develop a full thickness frostbite, and then, of course, had scar tissue. So nothing comes without risk. Now, when we go specifically to liposuction, so let's get back to minimally invasive, right? Liposuction. There are complications to that as well, right? Now we need to talk about the difference between traditional liposuction in an operating room under general anesthesia versus tumescent liposuction in an outpatient setting with this tumescent local lidocaine anesthesia, which is just contained within the fat. Traditionally, complications with liposuction have occurred in a number of different scenarios. Number one, what we call mega liposuction in the operating room. This wouldn't happen in an outpatient setting, but in the operating room, when they've decided to move more than 5 liters of fat all at once. This is a lot of stress for the body. There have been cases where 14 liters of fat was removed. Very stressful for the body and very high risk. Another scenario where liposuction has gotten people in trouble and even led to deaths is when people have tried to do too much at once. So you might have heard the term mommy makeover, right? Well, while we have you under general anesthesia, let's do 4 different things. Let's lift your boobs and suck your fat out, and let's do a tummy tuck and remove the skin. Oh, and let's do a butt lift while we're at it, right? Let's do it all because we've got you under. Well, the problem with that is that the risk skyrockets when you're combining multiple plastic surgery procedures. You're under anesthesia longer, that's raising the anesthesia risk. You're putting the body under much more stress, so you're much more likely to run into complications. Other things that can lead to complications with operating room and general anesthesia-based procedures are things like medication error, which is a known risk of general anesthesia, getting too much gas or too much of an IV medication, or getting fluid overloaded during the course of the procedure, because they do tend to pump fluids into you when you're under general anesthesia and you're getting, a bigger procedure done. So this all adds to procedure risk and also adds to downtime. And finally, another dreaded complication would be perforation into a body cavity. So understand that when we're performing liposuction, we're really just removing fat from under the skin. We're not entering the body cavity. We're not in the area where the organs are. I know when you look at it in a video, it looks barbaric or scary, but we're really just floating under the skin layer, removing subcutaneous fat. It's not as invasive as you might think. However, it's certainly possible if you're, aggressive or moving quickly. You could imagine, what if the cannula doesn't just float under the skin? What if it goes like through muscle into the belly or through muscle into the chest cavity? Well, here's the difference between liposuction with general anesthesia and liposuction with tumescent, where the patient is awake. If I were to get close to your muscle belly wall or your diaphragm up under your lungs with my laser tip or my cannula, you're awake at Renew MediSpa. You are going to tell me very quickly that you are in a lot of pain, that doesn't feel good, and you're not going to let me go further. If a surgeon has a patient under general anesthesia who is completely unaware, and they then happen to push up against the abdominal wall or the diaphragm, that patient is not awake to tell them something's wrong, stop, I'm in extreme pain, this doesn't feel right, etc. And that's a big diverging difference between traditional lipo and between liposuction with a local or regional anesthetic, is that patient feedback with traditional lipo under general anesthesia is not there. And thus, there are case reports with traditional lipo in an OR where someone has perforated through into the chest cavity, into the abdominal cavity, and didn't realize it until it's too late. Highly unlikely to occur with an outpatient procedure because the patient's not going to let you do it. Now, that's not to say that tumescent or local anesthesia liposuction is without risk. The main thing we guard against very carefully with this procedure is something called lidocaine toxicity. So to accomplish this as an outpatient, we're going to use a significant dose of lidocaine. The good news is that the safe range of lidocaine dosage, which is a weight-based calculation, has been very clearly established. However, if a physician or surgeon decides they're going to exceed that number for whatever reason, they can get into trouble and have gotten into trouble when they've exceeded what we know is a safe range. Additionally, of course, it's possible that a human makes an error. What if someone mixes a bag of solution and puts double the amount in it, right? Well, at Renew, one of the ways we guard against that is that our nurses are not allowed to mix the bags of tumescent lidocaine solution without a second set of eyes watching their every move. Okay, so we call that 2 sets of eyes, and also no distractions around them, no interruptions. All they're focused on is the preparation of those 3 bags of solution. And you've got the nurse preparing it according to a set protocol, and she or he has a second set of eyes watching their every move and guarding against a mathematical error. So that's really important in terms of maintaining safety. The safety of tumescent laser-assisted liposuction has been very well established. You can see even in this particular review, which dates back to 2011, they looked at many, many cases, I believe over 100,000 body areas treated with this form of liposuction. And with the tumescent technique, there were no serious complications of things like death or pulmonary emboli or hypovolemic shock, or penetration of the chest or the belly, or blood clots, or seizures, or toxic anesthesia, or any of this. And that's been borne out over the years, that this is an extremely safe procedure. The gentleman in the lower right is Dr. Klein. I would consider him the father of tumescent liposuction. He certainly did a lot of the studies which established what the safest dose ranges were, and we certainly go by his recommendations when performing the procedure at Renew. It's important to know, though, that lidocaine does actually interact with a lot of prescription medications and even herbal supplements. So we are very careful when evaluating our potential clients at Renew for tumescent lipo to get a full medication list and a full supplement list, because there may be medications and supplements that you need to discontinue to ensure that this procedure with lidocaine is safe for you. What about avoiding other unwanted outcomes? Now, this is kind of more where we focus our energy, right? Because we know how safe our tumescent lidocaine is in the way that we prepare it. Well, of course, an unwanted outcome would be excessive loose skin, or an uneven or lumpy looking result, or obvious scar tissue, or removing too much fat. Actually, that's not a good thing. You need a soft layer of fat under the skin for things to look smooth after the procedure. We don't want anyone to look skeletonized. And certainly we don't want to disrupt the actual blood flow to the skin itself. There have been cases with over-aggressive liposuction from any type of mechanism where they removed so much fat that the skin couldn't get enough blood supply. This is very significant, risk or concern. And of course, there's also the possibility, once you're done with the procedure, that there'll be a collection of fluid under the skin if the procedure was maybe a little aggressive, or more importantly, if the patient post-procedure was not as compliant with their aftercare garments and with their aftercare recommendations, there may be a fluid collection which needs to be drained, and that's called a seroma. So basically, avoiding these type of complications is three things: technique of the person performing the procedure, in my opinion, combination therapy. So we utilize the laser to help ensure the smoother result, and also very important that you comply with your post-care protocol, because you too are important in preventing complications. A seroma, once again, is a pocket of lymph fluid, also called serum. Serum is that portion of the blood when you take all the cells out and you're just left with the liquid. All right. So when we're doing liposuction, we're creating some trauma, and we don't want there to be a pocket of fluid that develops between the skin and between the tissue that's left under the skin, almost like a trapped pocket of fluid. We'd like to avoid that. That is the biggest reason why we have you do the compression garments. If a seroma forms, it's not the end of the world. A lot of times they'll go away on their own. Sometimes they need to be drained by needle. I haven't personally had a seroma complication thus far, but again, this is something that could occur. You'll see it mentioned in your consent form, essentially, as a potential complication. So let's move on. Who is a good candidate for liposuction? First of all, it's important that your weight has been stable, and we usually like it to be stable for about 6 months. You should be in good general health and be following a healthy lifestyle, with diet and exercise being your norm, not the thing that's outside of the range, right? We certainly want to make sure that you have realistic expectations and that you're able to comply with the post-procedure protocol. Who is not a good candidate for liposuction is someone who is planning to lose a significant amount of weight in the near future. If that's the case, you should do that first, and then have a stable weight for a period of time before you go into liposuction. Someone with an unhealthy lifestyle, someone with unrealistic expectations, of course, or is not in good general health, is not a great candidate for liposuction. If you have an abdominal hernia, which means that there's a portion of the colon essentially that's pushing through the muscle of the abdominal wall and going up into the fat, that would be an issue for liposuction via traditional or laser assisted, because we don't want to risk that the laser or the cannula is going to perforate that bowel. So that could be certainly a contraindication. So if you have a hernia, that needs to be repaired first, and then you could have liposuction down the road. Someone with body dysmorphic disorder is someone who imagines themselves to need contouring or weight loss or what have you, when they really don't need it at all, right? There's a disconnect between what's realistic and what's not realistic. So we certainly wouldn't want to work on someone with body dysmorphic disorder. Now, advanced age is listed there because as you get over the age of 60, certainly, you're more likely, let's say, to have some undiagnosed underlying issue, which could pose additional risk. So usually we would say, maybe if you're going to have liposuction and you're over the age of 60, you might want to have that in a more monitored environment, perhaps within a hospital setting, just in case something unexpected were to happen. I put smokers here because Smokers do have issues with adequate wound healing. So if you do smoke, it's advised that you stop smoking before having a liposuction procedure, or consider not having the procedure at all. And finally, a history of keloid scars. If you're someone who does not scar well, who gets really heaped up scars, maybe this is not a procedure for you, because there are going to be multiple stabs or pokes where the cannulas go in, and each of those entry points is a potential site for a keloid scar. So that could be cosmetically unsightly and might be a reason why you might not want to do this procedure. Someone not a candidate for liposuction is definitely someone who perhaps, again, unhealthy lifestyle, has a lot of visceral fat. So it's important to understand here that there's a difference between visceral fat and subcutaneous fat. The subcutaneous fat is that layer of fat under the skin that we're working within with our cannulas, with our suction devices. We are not going anywhere near visceral fat, which is the fat that's wrapped around your organs. So the proverbial beer belly, sure, there's some subcutaneous fat there, but there's a lot of visceral fat, a lot of enlarged fat wrapped around organs. No form of liposuction, whether it's traditional liposuction in an OR or tumescent liposuction in an outpatient setting, we're not targeting visceral fat. Nothing's going to touch that fat at all. The only thing that's going to touch that fat is weight loss. So it's important to sort of like get a sense of, when we're evaluating a patient, all right, how much do we think might be visceral fat? Is this really somebody who, after we suck out the subcutaneous fat, are they going to get the kind of contouring, the kind of look that they want? And if we think, I think there's a lot of visceral fat here, we're going to recommend against the procedure because we don't want someone to be disappointed. Preparing for liposuction at Renew generally starts with what we call a discovery consult. So a discovery consult is a time when you would meet with my assistant, usually Ariel, to learn about the procedure in detail. We have a handbook which contains copies of all the forms we use, such as the medical clearance form, the lab order, the medical history form. We give you a whole list of medications that could interact with lidocaine that might pose an issue. So in some cases, we're telling patients, well, if you want to have this done, you're going to need to be off that medication for 3 days, or we're going to need to reduce the dose, or if you need to stay on it, we're going to need to use less lidocaine, which means we're going to potentially treat a smaller area. I mean, this is all something, we need to take into account when deciding if you're a candidate for the procedure. During the discovery consult, we explain to you the treatment zones, which I'll show you in a minute. We go over the pricing for the different areas, going according to size and complexity. We usually do some baseline photos at the discovery consult, or if not then with the next consult after that. And all of those consult notes that the medical assistant gathers and the photos are then presented to me so that I review them and at least give a preliminary approval, meaning I've looked over your medical history form, your photos, your goals, and I've said, okay, I don't see any red flags. If you're interested, you could take the next step. The next step would be what we call a planning consult. Again, we're ascertaining that you're overall healthy, you're a non-smoker ideally, you've been at a stable weight. We determine that you've received medical clearance from whomever is your primary care provider, and we give you the form for that. We give the doc or the nurse practitioner the information that they need to make, a reasonable judgment. We tell them exactly what we're going to do, exactly what's involved. We give them the list of medications that could pose a problem. We give them the list of medical conditions that could pose a problem. So we really, it's a multi-page form, but we make it as easy as possible for that provider to say, yeah, I think this is a good idea for this patient, or no, I have concerns. We do generally require some baseline lab work, again, as a backup to show that you're healthy. At the planning consult, we would, of course, confirm the zones you want to have treated and take photos if we hadn't done those reasonably before that. At the planning consult, you would select your actual date and pay a deposit for your procedure. So again, the discovery consult is just a very information gathering kind of consult. You're not committing to anything. In the planning consult, that's more where you're saying, here's my info. my doc or my provider says I'm good to go. I've got all my paperwork lined up. I want a date. I want to put a deposit down where, I want to be on the runway. So that would be a planning consult. You want to make sure if you're picking a date that you have at least 3 or more days off from work after your procedure. Now, I say 3 or more because, different jobs require different amounts of physical strain. So if you're someone who has pretty much a desk or low key job, 3 or 4 days off is going to be more than enough. If you're a construction worker or something like super duper physical, operating heavy machinery, that sort of thing, you might want a week off because you're going to be sore. So we will help you make this decision. But again, realize that the amount of downtime afterwards also depends on what you need to do, for work afterwards. And we have to help you make that decision. At a planning consult, we would go over the prescriptions that you're going to pick up before your procedure. We'd review those with you. We would measure you for the post-procedure garment, which is a compression garment that you're going to wear to guard against that seroma I talked about earlier. We would go over in advance the preparation instructions and the post-care instructions in advance to make sure there are absolutely no questions, okay? And very importantly, we would go over with you medications and things that you must avoid prior to your procedure. Literally, guys, if you were to do something as simple as take aspirin the day before your procedure, your tumescent liposuction procedure is effectively canceled. Literally canceled, something that simple. So it's very important that you not be on blood thinners because that adds a lot of risk and a lot of oozing, and it's not anything we want to really deal with in any sort of way. So we just make sure that there's just no room for misinformation or lack of information where that's concerned. And then we also help you plan your lymphatic drainage sessions, ideally after your procedure, because these sessions will help you heal faster, be more comfortable, and get a better outcome. So here you see basically our division of what are called treatment zones. These are commonly treated areas, which we divide into zones, or some practices call them areas, okay? Abdomen, upper and lower, is generally considered separately. The flanks are that area sort of above your waist. You might consider it your low back. The true waist is what's kind of riding right at where your pant line is, or just below it. Hips are certainly popular. We have bra fat either in front or in back. That's the fat that can sort of hang over your bra if it's excess there. The upper back or high back, you can see that on the diagram up there. You almost want to call that, just under your shoulder blades, if you will. And then there's the high back, which is sort of in that shoulder area. Not as common as some of these other areas, but every once in a while, someone will have that area treated. Thighs can be treated either outer or inner. The thing I'll mention about inner thighs is that the skin there tends to be quite loose. So this is a higher risk area to treat in terms of, am I going to get enough tightening, or is the skin going to be too loose? So it's a little bit trickier area. Some people will treat the fat above the knees in particular, or the buffalo hump, which is up on the back, sort of at the bottom of the neck. Under the chin, very popular area. I do focused liposuction there quite often. The pubic region, sometimes we'll be treating that area when we're treating that lower abdomen. Sacral or Wi-Fi area is that little triangle right at the top of the buttocks. It can be fun to treat that area. You'll see that in the video in a minute to create a nice little definition. You can actually look like you got a little butt lift without doing a butt lift if that area is treated. And finally, the banana roll, that little roll under the buttocks, which in this diagram it's sort of a burgundy color. That area has to be approached very cautiously because, believe it or not, that is a support structure. And if you do too aggressive a liposuction in that area, the buttock will actually fall flat like a pancake, and we don't want any of that. So only very limited lipo can be done in the banana roll. So on the day of the procedure at Renew, this is exactly what you can expect. We reconfirm your weight, we calculate your lidocaine dose, we mark the zones, as you can see here, to be treated and take photos of the markings. We do give you oral medication to help you relax. A typical arrival time would be roughly 9 a.m. We might actually start the procedure at 10 a.m. and a typical departure time, and I'm talking about a larger area like full abdomen or abdomen and waist, a typical departure time would be 4 or 5 p.m. So what's happening during all that time? Well, once you come in, it can take us about 45 minutes to mark you like this and take photos of those markings, plan everything out, get you in the right garments, cleanse the skin, etc. Then we move on to the actual lidocaine step. Instilling lidocaine into the fat takes 45 to 60 minutes, depending on the size of the area. It's important that that be slow. It's actually safer when that's done slowly over the course of about 45 minutes. So it's good that that is a sort of a slow step. And then we might even pause for 20 minutes and just let that lidocaine seep around and kick in and sort of diffuse a little bit, because it makes the procedure more comfortable. The very next step would be the laser procedure, and it's actually a double layer procedure. First, we lase the deeper fat sections to disrupt the fat, and then we go back in all of the sections and we actually lase the section that's closer to the skin, which is the tightening step. At that point, again, we'll often pause to let the patient get up, stretch, walk around, use the bathroom, have some water, have a little bit of glucose solution. We don't want anyone's blood sugar dropping too low. So there's a little bit of a pause there before we move on to the actual lipo or suctioning of fat. The lipo procedure of a larger area, again, it may take 45, 60, 90 minutes. It's going to take as long as it takes. It's important that we cover the area from multiple different directions, again, because that enhances a smooth result. And it's just very important for really beautiful outcomes to take your time during this step of the procedure. It's about another 30 minutes after that, getting you wrapped up into garments, getting gauzes put in place, getting all the different layers of the garment in place. Again, some hydration, bathroom break, all of that. And then finally, we then monitor you for 30 or 45 minutes after that, taking vital signs, seeing how you're doing, calling your ride, etc., to just make sure that you're really, truly feeling well before you exit the door. So as you can see, when you add up all those little steps, right, it's a full day to do, abdomen, waist, something like that. I'll mention here that one thing about tumescent or outpatient lipo is that the maximum lidocaine dose is going to limit how large an area we can do in one session. So usually we're doing, the largest area we're doing is abdomen and waist. So we're doing full abdomen and wrapping around the waist, maybe getting a little bit of the flanks. Beyond that, if you also want to do your arms or your back or your thighs or anything else, you'd have to do that in a completely separate section. Okay, so that's another way that, traditional lipo and tumescent lipo, diverge, because with tumescent lipo, we're going to be limited by how much lidocaine we can give you. So we're not going to get into these mega liposuction sessions. But remember what I said in the beginning is going mega lipo, doing it all at once, adds a significant risk to the procedure also. And for me, risk like that is not worth taking. So I'll just make that point here. Oops, let me click on my slide here. Finally, we do use a device called Venus Bliss, which we love, especially for its lymphatic drainage capabilities for our post-lipo patients. We do lymphatic drainage with the Venus Bliss using the skin tightening applicator of the device. This is something you can have done weekly starting 4 or more days post-procedure. We basically want you to the point where you're not having any fluid drainage, and then you can start your lymphatic drainage procedures. We find that lymphatic drainage enhances healing, reduces soreness, it reduces the likelihood of seroma formation, it enhances the smoothing that you get post-procedure, so that's important. And also it can be used for additional tightening if you need it. I mean, if the laser and the lipo itself wasn't enough to tighten you as much as you'd hoped, you can do additional skin tightening down the road to even further enhance your results. Venus Bliss sessions are not painful. They are completely non-invasive. They take 20 or 30 minutes to do, and they can be performed by an esthetician. So they're fairly easy to schedule. If you don't have venous bliss done for lymphatic drainage, you could alternatively go to a massage therapist who is skilled in manual lymphatic drainage. So lymphatic drainage can be done without a device. It's just more efficient to do it with a device. It's a quicker session, but you could have an all-out hour lymphatic drainage massage with your local massage therapist also on a weekly basis if you wanted to further enhance your results. So you have two options there. So I'm going to play this brief video here for you. It's just a few minutes that gives you a little bit of a view of what the whole procedure looks like in real life. This video highlights liposculpting at Renew MediSpa. For this procedure, we use the Smart Lipo Triplex to disrupt the fat, coagulate blood vessels for less bleeding and bruising, and stimulate collagen for skin tightening. The areas to be treated are marked and numbered. This helps us keep track during the procedure of the even distribution of energy to all regions. And of course, we utilize a sterile field. All areas to be treated are infused with a medication called lidocaine, which is to completely numb the region. Then, through small entry ports, I'm able to introduce the laser fiber and work section by section to disrupt the fat while simultaneously coagulating blood vessels and tightening the skin. The patient is awake but relaxed. He or she may report a sensation of pressure or tugging, but not any sharp pain. Seen from another view, you can see that the laser fiber is able to move back and forth and at different depths to ensure that the entire thickness of fat is evenly treated in all planned treatment zones. Utilizing the laser helps me to ensure a smooth and even result for my patients. Here you see some example images of patients treated with the Smart Lipo Triplex. As you can see, they get a smooth, even result, as well as skin tightening. Printed photographs help us to keep track during the procedure of which boxes have been treated. We're recording the energy delivered and the temperature of each section. There are many different areas which are popular for liposculpting. Here you see me working on one patient on the back of her arms. In this clip, the laser is working on the flank region, which is the section right above your waist. The red circles indicate entry points, which I had planned at the start of the procedure to give me multiple different ways to access the regions we want to treat. Note that the laser is not actually removing the fat. It is simply treating the area to disrupt the fat and also to tighten the skin. Fat removal will be accomplished with the Vibrostat Liposuction device. At any point during the procedure, if the patient is at all uncomfortable, I can easily instill more lidocaine using a thin needle, and the patient really doesn't feel much of that because they're already partially numb. Once all lasing has been completed, the fat is removed using vibration-assisted liposuction. If you look in the lower left-hand portion of the screen, you can likely see the fat exiting in the tubing connected to the Vibrostat device. This procedure requires no general anesthesia. The patient is relaxed, but awake and able to change position and respond to questions. And here are some of our recent results. As you can see, we get a very nice amount of skin tightening. Small marks may be seen at entry points as little brown dots. These can be treated with laser if necessary, but even if untreated, they tend to go away on their own. Once again, you see a significant volume of fat can be removed without leaving loose skin behind. If you're interested in learning more about liposculpting at Renew MediSpa, you're welcome to join us for a discovery consult where we'll give you all of the information you need to evaluate whether this procedure is right for you. I also recommend that you consider watching my full video on liposculpting, which can be found on our YouTube channel. This is Dr. Lisa Vuich. Thanks for your attention. All right, there we go. Let's see if I can. Oh, hold on. We got a little patient experience video here too, kind of fun.
Hi.
Uh-oh, let's see if we can play it here.
Hi, I'm Leslie, and I'm at Renew MediSpa here in Derry, New Hampshire. It's like luxury here. Yes, I have abs for the first time. I have that V shape. I have, I have a waist. I've always struggled with having an actual waist and that hourglass figure my entire life. It's just the way that my body was built. I've always been fit. I always run. I always go to the gym. But now I have a waist and I have a V. The skin tightening from this procedure has been so phenomenal. My abs and my belly is smooth now, and I feel great in my own clothes.
Okay. I think we're good here. Let me just make sure I didn't. Yeah. So that was Leslie. She was certainly someone who was at a stable weight, who exercised regularly, and really, as she told me, she just couldn't lose the mommy pooch. So we did do Leslie's abdomen and waist. We did the smart lipo laser and vibration assisted liposuction, as we've been talking about. Now, she actually went to a massage therapist for lymphatic drainage. She had this done at a time when we didn't have the Venus Bliss. She did very well with that. She was very consistent with that and certainly wore her garment. She got a beautiful result, and we're just so pleased for her. So I'm gonna skip over that now. Here's another client, a little bit older, actually in her 50s. Again, we did smart lipo laser and vibration assisted lipo. We did her full abdomen and also wrapped around to the waist, as you can see, wrapped around her back. At 3 months, you see this photo, and I checked in with her recently. She said, I'm glad I did it. I'm looking forward to getting even more tightening. If you do see a little surface skin irregularity there, that's actually from the clothing she was wearing. You can even see on her hip, you can see where her pants were like denting into her skin. So just understand that those little irregularities are from, skin effect of her clothing. They're not from the lipo itself. So she's actually quite pleased. Here's one where we did abdomen and waist in a man. And also just a little bit of fat he had kind of up off the side to his pec at his request. And I put this here so you can see what he looked like even just 1 week post. So you see he's got a little mark here or there from entry points. He's got some faint bruising. He's looking pretty good, even though he's still very clearly swollen at this point. So, even at a week, it's looking pretty good. But generally what we tell people is this result is going to continue to evolve over the course of 9 months, in particular the skin tightening piece of it. So you do need to be patient with it, do your usual healthy lifestyle, etc., and just, keep going. And let's do photos at 3 months, at 6 months, at 9 months, and see where it lands. In this patient, we were focused primarily on her back and also posterior bra fat. That's the fat sort of behind your underarm. And you can see this isn't even a 3-month photo, I think, but you can see clearly that the skin is tightened nicely. She's debulked in the area, and we'll look forward to seeing her future photos to see where ultimately her result lands. A close-up again of the arms case. I think we showed a view of this before. Again, even an arm with fairly significant fat accumulation, just genetically, she tends to hold weight there, but significant skin stretching can taper in very nicely. And this is actually just a 1-month photo result, at which point she was saying, I love my arms, whereas before she wouldn't wear anything that was sleeveless. Now she's very comfortable in sleeveless clothing. So this is our lipo team at Renew. Generally, there are 3 people in the room. There's myself, very often Heather, my nurse practitioner, and one other person, either Ariel or one of our RNs or another medical assistant. Again, usually 3 people total plus yourself. Depending on the day. And these are usually procedures we perform on a Thursday or a Friday. So I hope that's been very helpful for you. It's been my pleasure to bring you this information. We are very happy to answer any questions you might have. Please feel free to call us, book a discovery consult. We do believe in no pressure sales. We just want to provide you with the information, make sure you're making the best decision for you, and that this is something you can safely have done. And then if you should decide to proceed, you would then go on to a planning consult to actually take the next step. My name is Dr. Lisa Vuich. Thank you for your attention, and I hope to see you in the future. Have a great night.